Hi, I'm Nora Smalley, and I'm part of Group 4. And due to having work when everybody else is home, I am going to record myself for this part, the first part of our project. So, here we go. The licensing body for the Food and Drug Administration has been tasked with reviewing the current products of monoclonal antibody therapies for authorization for the treatment of COVID 19. The SARS coronavirus disease of 2019 was previously known as a novel coronavirus, which is a term attributed to the strains of coronavirus which become prevalent enough to reach medical significance. Novel meaning a new pathogen of a previously unknown type as defined by World Health Organization. SARS, an acronym standing for Severe Acute Respiratory Syndrome, and CoV-2, an acronym for the second novel severe acute respiratory syndrome. Coronavirus disease, the previous outbreak taking place in China during the SARS outbreak of 2003. This pandemic affected numerous people in the world, changing countless lives. These therapies will help many people who need treatment for SARS CoV 2. A survey was held by Pew Research stating that 89% of their survey that they held mentioned at least one negative change in their lives, and 73% mentioned at least one unexpected upside to the pandemic. Most people in this survey stated that they have experienced these negative impacts and silver linings all at the same time. Two-thirds, or 67%, of Americans had mentioned at least one negative and at least one positive change since the pandemic began. In many ways, the negatives clearly outweigh the positives, an unsurprising reaction to a pandemic that had killed more than 180,000 Americans at the time the survey was conducted, was a quote from Pew Research. Numerous participants in the survey submitted statements. Some were negative and some were positive. A negative example is the destruction of our routines has been disorienting. A positive statement was mandatory relaxation, reading, needlework, crosswords, and long outdoor walks. No commitments on my calendar to worry about. The SARS CoV 19 pandemic began in December of 2019 in Wuhan, China. Since then, it has morphed into a pandemic with a reported 273 million cases and 5.3 million deaths worldwide. As reported by the World Health Organization's weekly report on the 21st of December 2021, first, a monoclonal antibody is an antibody that is made in a lab for a specific infection, and the antibody is expected to fight off that infection. This is completely different from getting a vaccine. A vaccine triggers a natural response to fight the virus or infection, while the monoclonal antibodies are what is needed for the body to fight the infection. If the patient lacks antibodies to counter the SARS CoV 2 infection, then a treatment of monoclonal antibodies is required, as a vaccination is a prevention method and not a treatment. If the FDA does not rule on or authorize any monoclonal antibody therapies for treatment of COVID 19, it will result in people dying in a climb of death rates of SARS CoV 2. As the infectiousness of COVID 19 is most severe before symptoms are present, and these treatments advise their use after symptoms of the disease have begun. The reduction in infection rates will not be reasonably affected by the approval of these monoclonal antibody therapies.